What is happening, party people? I am stoked. Today we have a guest to go over literally the most requested podcast episode of all time. And we are talking all things prenatal and postpartum exercise. We're talking exercise timeline for leading up to pregnancy. Can I get started exercising if I'm pregnant? What are some of the biggest myths about what I can and can't do while I'm pregnant? Spoiler, these blew my mind as a trainer. It is a must listen. And then we talk about postpartum. What should exercise look like after we have our baby? And remember, postpartum isn't just 6 weeks after your baby. It is for life. Once you're postpartum forever. We have the one and only Coach Anna Hultgren, who is a certified prenatal and postpartum fitness specialist, mom of 2, and owner of Twin Cities Wellness Studio Carpe Diem. She is outstanding. You can hear the passion just pouring out of her voice. She's so knowledgeable. I am just so excited for you to get into this episode. So without further ado, let's talk all things pregnancy and movement. But first, welcome to Fit After 40, the Women's Fitness and Health Revolution podcast. Kinsey here, certified personal trainer and menopause coaching specialist. I've worked with hundreds of clients over the past 12 years and know firsthand how intimidating starting a fitness routine can be, especially in perimenopause. My goal is to teach women in midlife and beyond how to feel strong and confident in their bodies and to help them live the healthy life they deserve, free of pain, heart disease, dementia, frailty, you name it. In this show, you'll get action steps you can take today, backed by the most up-to-date research and thousands of hours of practical in-gym experience. The best time to get started may have been 20 years ago, but the second best time to get started is today. Hello, and welcome to Fit After 40, Women's Fitness and Health Revolution podcast. Coach Kinsey here, and today I am thrilled to announce our guest just in time for a slightly belated Mother's Day, Coach Anna Hultgren. Woohoo! Hey, Anna, thank you so much for making this work. For those of you who, how would you know? We tried this once, and we were defeated by Wi-Fi, so Coach Anna not only gave you one, but 1.5 to 2 podcasts. So she's really coming through for y'all. How are you doing today, Anna?
I'm so good. So glad to be here. So glad we're making it work, making it happen.
Yay. Me too. I'm so pumped. I was telling you this, but I also, probably these listeners, maybe, I feel like I've talked about this before, but this episode that we're going to have has literally become the most requested episode of all time, like zero exaggeration. Every time I put a poll out on Instagram or in my email asking the topics that y'all want covered, someone, and usually someone's multiple, ask about prenatal and postpartum workout advice. And it is with 8,000 pounds of gratitude that I get to say, today's the day, because we have just the coach. Anna Hultgren is a certified prenatal and postpartum fitness specialist, mom of 2, and owner of Twin Cities Wellness Studio Carpe Diem. She's worked in both one-on-one and group settings for over a decade and is passionate about helping everyone reach their wellness goals, but particularly women who have experienced pregnancy and birth. Anna has her bachelor's of science in kinesiology, is a certified personal trainer with ACSM, a certified Pilates instructor, a group fitness instructor, and a prenatal and postpartum specialist with Pronatal. However, she believes what really gives her the ability to apply her knowledge and coach women through fitness and pregnancy and postpartum is her experiences through pregnancy, birth, both C-section and VBAC, and motherhood. Anna believes that knowledge is power, and she works not only to empower women in pregnancy and postpartum, but instructors and trainers as well to be confident and knowledgeable in their training. And that couldn't be more true. I said it the first time we tried to record this podcast, but I think everybody needs to know I look up to Anna a lot as a coach. I mentioned last time you are the reason that I know how to row. So thank you so much for that. No.
Exaggeration.
It is not, y'all. I started at OTF and I had a coach and I was like, oh no. I literally, you can ask Cole, I was like, oh no, I can row-ish kind of. And between her and another coach, Coach Kelly, I went a little bit slower and actually started learning how to row. So that's one of the things I always say, find you a coach who continues to learn. And Anna is really one of those people who is so passionate, it shines through, and she's got so much to give both her clients and instructors working around and with her. So I've learned a ton from you, and I'm so excited for you to share your wealth of knowledge with everyone. And as y'all probably guessed, today we are diving into all things pregnancy and exercise. Whether you had a baby, are currently pregnant, or are thinking about getting pregnant, this one is a must listen. So let's dive on in. But before we get into the nitty gritty with the questions you guys have asked, I'd love, Anna, if you could just sort of give us a bit of background in terms of what inspired you to get certified as a pre-postnatal coach. Because y'all, that is not something that most personal trainers have. She had to seek other certification, do a whole program, and learn this. So it takes a lot of hours when we go off and find our specializations. So what made you inspired to go off and do this?
Yeah. So, for me, I really started off in group fitness and had been teaching that for several years. And then at the point where I got pregnant with my first son, I really, or up until that point, thought that I kind of knew what I needed to know to safely guide, pregnant and postpartum women through workouts. And felt pretty confident in the recommendations that I gave, and kind of these are the textbook answers and whatnot. And so it's kind of like one of those, I didn't realize what I didn't know until I realized it. So once I got pregnant, I all of a sudden had all these questions, and I was like, oh, what should I be doing? How much should I be running? How heavy should I be lifting? Should I be doing core work? What is the impact of all these things? What are the recommendations? And so, the first person that I asked was my OB, and I think that's, probably most common. That's what, where people turn to. And I was kind of met with you're a trainer, so you should, you just, keep doing what you're, whatever. And I was like, all right, that's really the answer I was looking for. If you turn to Google, as we do, and now, you got ChatGPT and everything thrown in the mix too, it definitely is going to send you down all these paths, right? You could Google, should I do core work during pregnancy, and come up with, 7 different answers, and who knows if any of them are right. So kind of through all that, I decided, I really wanted to get certified and know and have the knowledge, not only for myself, but, it just was this kind of big awakening moment for me of how many women do I work with, and especially in the group fitness industry, heavily women, it's, 85-90% women in most of my classes. And it's what a disservice that, I don't know more about this area, that we all don't, right? But I felt that. So, so decided to do a prenatal and postpartum certification. And I did that while I was pregnant with my first kid. And for me, that really helped cement and solidify so many of the concepts to be experiencing the things that they were talking about, while, learning about it. So I did that. And then since then have just really continued to grow and learn, to work with clients one-on-one, to apply that knowledge to, all students and members that I work with in classes. I really have a passion for spreading that knowledge to other trainers and instructors. Cause like I said, if 85 to 90% of the room is females, and obviously not everybody has had a baby, but many of them will have babies. Many of them have had babies, right? Even if they're not, in that early postpartum stage, you're always postpartum once you've had a kid. And so I was it just it gets me so fired up to think all these people have this missing knowledge of how to be teaching people how to do things. So that's something I'm really passionate about, is just not only helping women feel empowered, but also helping trainers and instructors feel empowered in that area too.
I love that. Yeah, it's so inspiring when it comes from our own story of oh my gosh, to be told by a doctor, none less, that you're the expert, and being oh no,
I'm not. I'm not. And I think Just to to clarify too, like on that point, what I always tell people, like doctors are really great at what they do, like please nobody else be doing a C-section on me. But part of their education, similar to, kind of similar to nutrition, they don't spend a lot of time in medical school on nutrition. They don't really spend much time in like fitness, just isn't their thing. That's not their job. It's not, what they're dedicated to. I do believe that you should really find a provider who is up to date on what they should know and what the recommendations are. But again, it's not their thing. It's not their corner. And I think that there's this like misconception. I think this is where the gap happens, is that for me as a trainer, I assumed it was their thing. I assumed that was included, that they knew all of those recommendations. And then again, it's like, they're assuming that we know more, just that you're your average general trainer. So I think that's where that gap comes into play. It's just this assumption on both sides.
Yeah, we see that a lot too in the menopause space, where doctors are so good at what they do, and thank goodness, like you said, there's so many things, and I don't want just anybody to do honor in my body. So thank goodness. But that is why on this podcast a lot we talk about having a team, because everybody, even if we just boil it down to like personal training, like I said earlier, this is a very specific certification. So most personal trainers, if they've been around long enough, will do continuing ed and kind of niche down into their pockets. So I'm really grateful you have, because like you said, so much of the group fitness space is perimenopause, wow, my brain, is female. And like you said, and I do love that you said it, and I'm just going to say it louder for the folks in the back, postpartum is forever. So if your baby was 20 years ago, you're still postpartum. Once a baby, always postpartum. And so I think that's just such a good thing to remember when we're thinking about fitness in general, that your body has forever changed. And that's a pretty cool thing. Yeah. Okay, I love that. I didn't write this down, but I am just curious, because you went into your certification an open book. What was one of the things that when you took your certification was the most surprising that you learned for yourself going through it?
Oh my gosh, what a good question. I'll preface this by saying I tell people that out of any education that I have done, including my 4-year degree in exercise science, this certification has been the most life-changing for me. Now, obviously, right, I have kids. I've been through the birth experience. I am extra passionate about this topic.
Yeah.
But it is so like, you're just like learning at so many things, that like you don't learn in like a typical personal training certification or any of my exercise science classes. Or my husband has his master's in exercise physiology. He does not know any of these things. Yeah. So it's just such a niche area. So anyways, try not to go down too many rabbit holes.
But I think that's worth saying, because I think that's pretty wild. I say all the time here that I didn't learn anything about the pelvic floor until my menopause coaching certification. That never came up in any of the like NASM, anything. So sorry to cut you off. Continue.
There's no, you don't even look at like the anatomy of a pelvic floor or anything like that. So yeah, I think probably one of the tools that I use the most, learning about breathing techniques and learning about your diaphragm, your pelvic floor, your core, that whole like more in-depth structure. I use that a lot. I use that tool in how I teach, in how I assess people. So that is probably like one of the most instrumental things that to everybody. It doesn't matter if they've had a baby. It doesn't matter if they're pregnant. Like that knowledge extends to everybody that I work with. I think maybe kind of surprising to learn that you should, in fact, be training your core during pregnancy. I think I kind of assumed like you shouldn't be. So it's, a little bit more specific, or there's certain things that, eventually we kind of work to avoid. It's not cut and dry, but that was probably surprising to learn, how much you really should be training your core.
Yeah.
Yeah, again, everything I felt like was new and shocking, but those are probably a couple of things that just kind of felt like, okay, yeah, I wasn't expecting that.
Yeah, that's awesome. No, I was just curious because, like you said, having had your background in exercise, in kinesiology, all these things, then going into something that is just a whole different world. So that's really cool. And yeah, we'll talk more, y'all, about what she was talking about with training the core, et cetera. But that is one, especially when people think of just core being exclusively crunches, where you're like, that would be how do you do? It's just, I'm so glad you're on here because like you said, I've been training for years and I don't have the certification. So I've learned how to work with my clients and I've learned a lot from coaches like you and sources, but it is something that I still feel like there's so much, just there's such a lack of clarity around like what, and it feels like every time I go to like look at working with a new client, information has shifted. And now like things that used to be not okay 10 years ago are okay now, or like you said, Dr. Chat GPT, which is just a whole other can of worms, y'all. That thing just pulls from whatever is popular. So I am so grateful for your expertise, and let's just dive into all your good information because I know everybody is curious as well. This one is more from like my coach brain, and then I'll get to your guys' questions, okay? But I think it's important to hear because we're going to talk about the phases of pregnancy, starting with preconception. I don't think a lot of women think about leading up to it, and I want us to change that script. So do you think that when a woman is thinking about getting pregnant one day, even if it's like years in the future, is there a benefit for her having a workout practice leading up to her conception?
Yeah, I think obviously almost a rhetorical question, almost, right? Like, obviously, you know how I feel about exercise and strength training, and it's so important. So, 100%, so important. Should start before you conceive. The healthier that your body is, the healthier your baby is going to be, and that's just how it is. And even like I've been, as we're in this stage of life, my husband and I, where, we're not sure exactly how many kids we've had. I've been like down rabbit holes lately on like, conception, everything, whatever. And both sides, so important, right? Like your health matters for that baby's health. So yeah, absolutely. It really, it can help to reduce stress and anxiety. That's a really big thing when people are trying to conceive. The doctor's always talking about reduce your stress. Obviously, that's so hard when you are doing something that is so impactful and so important to you. It's hard not to be stressed about it.
Yeah.
But we know that exercise can help reduce that and help manage stress and anxiety. I think it also just creates so much physical toughness in just knowing, being pregnant and giving birth is hard. I don't think there's anyone that would argue that. Even people who like it acknowledge it's hard. And so, setting yourself up for success and doing those things, those types of things, kind of sets you up there as well. Something too that I hear a lot about right now and think a lot about, really connected to kind of your specialty, is a lot of times, especially with women having babies kind of later in life. We know after the age 30 we start to lose muscle mass, and particularly when you go through pregnancy and birth, you also lose muscle mass, and you lose a lot of strength in that period.
Wow.
And a lot of times what happens is, you go through this, pregnancy and postpartum time, and then if you never like do that rehab and that strength training and rebuilding, especially if you're having kids later in life, now you are basically sliding right into that time of not weakness, but maybe, that healing time for your body, and you're just kind of going right into perimenopause, and they kind of like go right into each other. And so if you're not building up first, starting on the front end before pregnancy, it just starts to like kind of stack on top of each other, and you just start to feel those kind of year after year. And especially pregnancy after pregnancy, a lot of times people will say like, oh, I didn't feel this my first pregnancy, but then if they didn't do the rehab in between and they don't feel like they had much time, then they will really feel it their second one, and then they'll really feel it their third one. And so yeah, absolutely, so important to build up as much health as you can, build up as much muscle as you can prior to getting pregnant.
I love that. And like I said, that one was kind of for me, but I love everything that you said too. Just down to the like reducing stress and anxiety, the resilience of going through hard things. Like there's so many benefits that come along with getting a routine down. And I do think, I love that you mentioned, I love that women are healthy enough and that we're living in an era where women can have babies into their late 30s, into their early 40s. And it is also important that as we see that happening more and more, that we're talking about this kind of stuff, because I have a lot of clients who had their first kid later in their 30s or early 40s. And exactly what you said, they came right off into perimenopause. And it was the muscle mass. Remember, too, that we can, especially when we're breastfeeding, we can see drops in bone density and just mood, right? Like that alone is fatigue. There's so many things. So if we can just kind of have this idea of what we're heading into, we don't have to be freaked out about it, but we can sort of bulletproof our lifestyle. So I love that you brought up all those things, because I do think that's something that we don't really think of, especially when we're so excited about having a baby. We forget that on the other side, like it's all this change is happening in our body. Like we said, postpartum is forever. So that's awesome. I love that. And also I love what you said about having a healthy body means a healthy baby. I hear about it in the nutrition space too, where when women are starting to get pregnant, they're just for the first time considering like how they're fueling their system. And it's like, in a perfect world, we would be fueling our system like we were trying to get pregnant all the time. So I like to think about that as movement too, right? It's just to take care of our machines as human beings. So love that. So thanks for letting me ask the trainer question, y'all. Now to yours. So that was thinking about getting pregnant or on the path. Well, let's talk about pregnancy. So one of the biggest questions that I get from listeners and clients is, can I start working out when I'm pregnant, even if I've never exercised before?
Yes. Yep. And so that is one of the biggest maybe like myths or misconceptions. So it used to be a recommendation that you kind of stick with whatever activity level you had prior to pregnancy. So that did used to be an official thing. So that's kind of where that confusion comes from. But it's been a while, like decades, since they've kind of like started making this shift now. And basically research shows that the benefits so far outweigh any risks that they've ever been able to measure, that you should definitely start an exercise routine when you get pregnant. Because like you said, even like with nutrition and everything, sometimes it just is when you start thinking about it, when all of a sudden you're thinking about the health of a baby.
Fair.
You know, it's just when you start taking it more seriously. And so yeah, absolutely start a routine. Does it mean go out and train for a marathon if you've never been a runner before? Probably not. Like that's just not going to be the best choice. It's not going to feel really great in your body. Your body's not going to be accustomed to that, you know, extreme amount of running. So yeah, so I wouldn't really recommend that.
Me neither. Period. Just kidding.
Yes, exactly, right? But you definitely can run while pregnant. I know I've had friends who have, you know, safely run all the way through their pregnancies. I thought I was going to be one of those people. I was not. That's okay too. But definitely, I think especially like starting a strength training routine, it doesn't have to be really heavy. It doesn't have to be really aggressive, but definitely a strength training routine. You know, cardio can come in so many forms. Obviously, you know, some running could be it, but it definitely doesn't have to be running. But yeah, current recommendations from ACOG, which is the American College of Obstetrics and Gynecology. So that's kind of like your kind of medical governing board, who's deciding, you know, who keeps track and does all the research and decides, you know, what is what, right? And it's not just exercise related, right? That stems, you know, to all things pregnancy and postpartum, sure. So, and women in general. So, yeah. So yes, should start a routine no matter where you're at.
Love that. Yeah. Love it. I also love that you shared that you thought you were going to be one of the women who was running all through pregnancy and you pivoted. I love that, A, because thank you for being honest, and B, it gives everyone permission to not feel like they're stuck to something. I think a big takeaway too is listening to our body. It's same pregnancy, but also same in life. Like if something doesn't feel good, don't do it, or get a coach and make sure it's safe to do it. Okay. Mm-hmm. I am not even pregnant. I'm not going to be out here training for a marathon. So if you need someone to tell you that's okay, come find me. Okay. So you've hit on a couple of these already, but I would love just to go over some of the benefits of exercising while you're pregnant. So I imagine it's an exhausting time. There's a lot of changes. There might be this thought of like, one more thing. Like, what's the point? Is it just like an aesthetic? So I got biceps while I have a baby. Like, what's the benefit of actually putting in this kind of work while you're going through this?
Yeah, totally. So kind of like I already touched on, we want to almost, bulletproof yourself, right? Like you said, like build up as much as you can, because it's going to be hard. It's going to be tough. It's going to take a toll on your body. But that doesn't mean that we just kind of like let go and stop taking care of our body. So, building up as much as you can. One of those kind of really specific things, one of the biggest complaints during pregnancy is back pain. It's really common because you are putting weight on in a very specific area, and it's all in the front of your body. And so that pulls against your core, it pulls against your hip, and it pulls your lower back. And so it pulls the hips down, and it starts to kind of compress that lower back area. But your hamstrings and your glutes are connected, and so the stronger on the backside. So the stronger your hamstrings and glutes are, the more it like pulls things back into place, right? So we have all the weight pulling you one way on the front, but then when we have strong glutes and hamstrings, it's pulling you back. So a lot of times, so common, I will see people who, just found out they're pregnant, or they just told me they're pregnant, and they'll be doing a goblet squat and they'll be doing like 10 pounds, and I'm like, what's happening right now? Not the time to take it easy on leg day. It's really important to maintain leg strength. And again, those glutes and hamstrings specifically. Obviously, is there going to be a time where maybe body just doesn't feel like it always does, and you need to make adjustments for sure. But I always tell people don't make an adjustment or a switch just because you're pregnant. There's always a reason. There's very, very few times where it should be like, oh, I'm not doing this because I'm pregnant. There's usually other reasons that fall within that we can talk about. But yeah. So lifting, super, super important for strength. It can really help with back pain, and just keeping your core supported. Again, we touched on it, but mental health, it's so huge. People all the time will ask me, during both pregnancies, they would ask me, when are you going to stop teaching, or when are you going to stop working out? And I'm like, hopefully not until the day I give birth. So just moving and just keeping things going, as much as possible, is really important. And for me, that helps my mental health so much, to be able to stay in that routine, to keep showing up for myself, to keep having that time for myself, is really important. So helps with mental health a ton. There's some studies that show that it can decrease the risk of prenatal and postpartum depression and anxiety by 67%.
Wow.
That's huge. That's massive, right? Think about, all the things they prescribe to help reduce, those mental health things. And all we have to do is move. All we have to do is move our bodies.
67. That tracks. There are other studies that go along with just strength training for a human body. And when they've tested them against groups who just do anti-anxieties, I forget what they're called, not NSAIDs, that's a different, but basically they show that exercise has the most positive effect on mental health and lightening the mood. So that makes a ton of sense. And that is something that I think is another thing we need to talk about more, because it's definitely something that I think the modern woman really struggles with in a bigger way than I think we're starting to talk about it more, but that's a big one. It's lonely to be a mom in this day and age, especially if you're living somewhere you're not near your parents. So just being able to continue to find that support for yourself. And like you said, having that moment for yourself too. Sorry, I cut you off, because 67% is crazy
number. Yeah, for sure. Other really big benefits to it, 40% decreased risk of things like gestational diabetes, preeclampsia, hypertension, and that's huge, because I will tell, which now, caveat, I did have preeclampsia with both of my pregnancies, and so that is also for all the mamas out there who have had, and I've had friends who had gestational diabetes, so for all my friends out there who have had things like that and have had those complications, it's not your fault. It doesn't matter what you do, right? It's, sometimes your body is just going to do what it's going to do, and I think that is really important to note in all these things that we're talking about, right? Because there's always going to be exceptions to things. But, so that being said, I've had preeclampsia, which is a hypertension disorder that can get pretty severe during pregnancy. So I've had that both times. And one of the only things that like they like can give you to help reduce your risk. So like my second pregnancy, they gave me a baby aspirin every day, which reduces your risk by 15%. But they're saying that exercise reduces your risk by 40%.
Dang.
So like just like, huge differences, right? So that's again a big number, and those are serious complications. So anything that we can do to, set ourselves up better for it, for sure.
And I love that you shared that again with everyone, because I think I've had plenty of clients, especially as they are having babies like over 35, who have maybe didn't have gestational diabetes for the first pregnancy, or maybe they did, but they work out, they're like hitting all the marks, and then they get gestational diabetes, and there's this sense of like failure on our part. And I'm love that you shared that, because any way we can change the narrative of women shifting blame off of ourselves, I think is really important, especially during this time. Like it just is, like you said, the bodies do what the bodies are going to do. And especially like there's so many reasons these things happen. And we're talking later pregnancies too. I've talked about it on the show before, but as we start to lose estradiol, we start to see insulin sensitivity go up anyway, as we start to see that drop in perimenopause. So there's so many compounding factors, and none of it is our fault. Just finding ways to support like that, I think is so, I just love that you shared that, because I think of one client in particular who had worked out with me for years and had it, and just was feeling like really tender around it. And it just made my heart break, because it was, she was quote unquote doing all the right things. And it's just like, it's so hard to not feel like, well, maybe if I just, and it's just good to know that like Anna, who's been working out pretty much for your entire life, question mark.
Yep.
It just, there's sometimes it just be that way. So stop beating ourselves up. You guys are amazing. Moms are superheroes. Okay. Sorry. Thank you again.
Nope, you got it. Yeah, I think I feel that way. I felt that way. I still feel that way. It's hard for me to battle those feelings of, almost like inadequacy, like I didn't do enough. But I know that I did. It doesn't mean I can't learn more. It doesn't mean I can't support myself more in other ways. But your body is going to do things however it's going to do things. Mm-hmm. And sometimes we don't have control over it.
And amazing that you, the proverbial you, is putting in this time taking care of yourself on top of it. Like that's a thing too, where I think like if these things are just going to happen, how much better off are we having these guardrails in place? So it's just like a protective measure of an inevitable. So I just think I think that's really cool. Okay. Sorry. I keep cutting off, because I just,
no, you're good.
I just love that. And I think it's so important for women to hear.
Yes. 1000%. One more thing too that I would highlight, like one more big benefit, is going to be actually for the baby as well. So I think that is what is really important, is that sometimes people, and there's always like trolls on Instagram, like whenever there's a, pregnant influencer working out or something, and there's just trolls in the comment section, like to your baby, blah, 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 blah. So it's not only is it safe for the baby, it is beneficial for the baby. So the more and more they research and study, it's just showing healthier babies coming from moms who work out throughout their pregnancy, specifically healthier birth weights. And I think people think like maybe like lower weight, not necessarily, just a healthy range, not super high birth weight, not super low birth rate, just kind of healthy and right where we want to see them. So it's linked to healthier babies, not just healthier moms. And I think that it says everything we need to know, right? The whole goal, healthy baby, healthy mom,
Yeah.
Stamp it. That's it.
That's it. And that's the podcast. Everyone, see you later. Thanks so much, Coach Anna. Healthy baby, healthy mom. That's crazy. I 100% did not know that. So that's really cool. Okay. I love that. So I don't know. I'm convinced, y'all. I know I love strength training, but also I hope you heard something in there that speaks to you. And like she mentioned, it's safe to get started. And if you work with someone like Coach Anna, they'll get you started the right way. So the same way that we'd get started when we're not pregnant, you still want to get started the right way. So definitely reach out if you have questions. So are there any movements or exercises then that are contraindicated or that are kind of off limits during pregnancy?
Yeah. Okay, so I'm going to pack that into almost like a couple different questions there. So there are certainly times during pregnancy where if you have specific conditions, you are going to want to chat with your provider about what activity looks like. So they have a list of, contraindications where, they're saying basically, if you have this, then speak with your doctor before exercising and whatnot. And most of the time, there's honestly very, very few that they're going to be like blanket don't exercise, right? There's not a lot of those anymore because, again, more and more of what we find out, like things with gestational diabetes, preeclampsia, right, all these things, we're finding out that exercise benefits most of these things, lowers the risk, right, or helps manage these conditions.
Yeah.
So there's not a lot anymore that they're just like, nope, no exercise. But you might modify it. You might keep the intensity a little bit lower. You might, adjust certain things. So doesn't mean that there's never an instance where we want to, just kind of double check back into things, or where maybe, traditional exercise isn't recommended, but not that common, pretty low. Again, especially just the more and more they research and learn. So I just wanted to like touch on those, like those specific like contraindications. And if you're like, well, how do I know? You can go to ACOG, and I think I sent you that link to post. And so they have lists. And so they have basically things that are kind of like absolute contraindications that are like, nope, this is a pretty like hard, like shouldn't be exercising if you have this condition during pregnancy. And then there are lists that are relative, that are like, okay, maybe we can, but we're going to adjust, right? Or we're going to work a little bit more closely with our doctor to figure out what is like a safe space for us to be. So that's kind of just to make sure we cover that. And then the other thing that I really like to specify is that there's a difference between what is safe for mom and baby versus what is healthy and helpful. So there's not a lot of exercise where it's like, okay, that's not safe for baby, or that's going to hurt the baby. So I like to give the example of like sit-ups. I don't typically recommend people do sit-ups past around their first trimester. And again, there's like specifics for each person individually. But is it going to hurt the baby if you do sit-ups? No. You're not crushing your baby. You're not hurting your baby. So that's what's really important to note, is that there are things that, are just going to be helpful for mom, right? I don't recommend doing sit-ups, further into pregnancy, because it's not helpful for mom. It's not training our core in the way we want it to, and it can do a little bit more damage than we want and just make it harder to heal on the other side. But does that mean we should have this fear around it of like, oh no, I'm going to hurt my baby? No. And so I want that to be really clear to people. Again, especially in the day and age of social media, you might see people posting things like pregnancy safe exercises to do. And I just like to squash that, because unless you are skydiving or a competitive water skier or cliff jumping, unless you are doing things that are inherently more dangerous for your body and just in general put you at a higher risk, right? There are not like certain core exercises that are pregnancy safe. There are certain core exercises that are more helpful. There are certain ones that are going to help you build your core in the way you want it to, help you recover faster, help you do a little bit less damage to the tissue through pregnancy. But it's not like, oh no, I deadlifted. That was not a pregnancy safe exercise. Now my baby is at risk.
Yeah, that's such a good, I'm so glad you said that, because that is the way the algorithm works, is the polarizing statements. And I imagine when you're pregnant, it's scary when you aren't trying to have a baby. It's like, you see the things of like, this is safe and this isn't, and nobody should deadlift. And you're like, oh my gosh, am I going to just crack in half? Like, I can only imagine the intensity of the fear when we see that. So yeah, I'm so glad you said that, because again, the last thing we need is to feel like more scared, especially as we're trying to take care of our bodies. And I was going to say this for later, but since we're here, do you want to share a list of some of the most common myths that you see today surrounding exercise and pregnancy at any phase? I love that you hit the crunches, because again, it just is in my mind as the old school training. It's like that would be, for so many reasons, you're not going to do it, but it was terrifying to be like, you would destroy the woman and her baby, and then you should go to jail. So that's how it felt when, so.
Yes. Yes, would love to share the myths, because can't get enough of, when you hear about those. And oh my gosh, the amount of times, somebody would look at me and say, oh, you shouldn't be lifting that, and
Yes.
one time we were in Arizona, and I was lifting a suitcase into the car, and my husband's grandfather's wife, so I guess like his step grandma, right?
Right.
She was like, don't let me take that. You shouldn't be lifting that. And I was like, Carol, no, you shouldn't be lifting that. I am just
Carol.
not really, like, so it's I have heard it, gotten it so many times.
Yes.
So I'm happy to spread the news on.
Love this.
Okay, so starting off with that one, lifting. That's a big one. People will say, don't lift over 20 pounds. That's so outdated. Everybody has a different capacity, right? Again, if you are just starting strength training, you're just starting to lift, right? And you're just learning how to do it. I think both of us would always recommend you start lighter, right? We always recommend that you start with body weight movements, you progress to light weights, bands, things like that, and then you continue to add and progress. That's how I would always teach somebody to do it, because you want to learn how to do something the right way. But can I lift more than 20 pounds as somebody who's been lifting and strength training for years? Absolutely, right? So everybody is going to be different and individual. There is no specific weight limit.
And is that for all 3 trimesters?
Yes.
See, that's the first time I saw it was back in the day when I did CrossFit, and there was a woman named Maggie, and I see her in my mind, literally was doing barbell back squats till the day she popped, and
Yep.
I was just like, is this? And it was,
Yep.
she's perfect.
Yep.
That's a big one too that I still hear. So thank you. Okay, carry on.
Yep. And I think really important to go along with all these is, even though there's question marks kind of floating around when you're pregnant and you're trying to figure out what to do and how to do things right, you also you are intuitive and you know your body and you know if something is not right. Yes. So don't get confused by everybody else telling you what to do and what you should and shouldn't do. There is a lot of this that is intuitive, right? So you probably are going to just know and feel how much you should be lifting, or be working with somebody who can, work with you on what you should and shouldn't be lifting. So that is not a thing anymore. Another really big one that used to be a recommendation was to not let your heart rate go above 140. And I used to tell people, man, I could do a few body weight lunges and my heart rate would go above 140 when I'm pregnant. Yeah. Something really important to note is that during pregnancy, your blood volume goes up by 50%. So usually around halfway towards the end of the second trimester. That's a lot more blood that your heart has to pump through your body. And so, of course, your heart rate goes up because it has to work harder to get blood to your body and to get blood to the placenta to keep the baby healthy. So your heart rate is naturally going to be elevated. Anybody who's been pregnant can attest to that, going up half a flight of stairs and, being winded. And, so your heart rate is going to rise. Giving that static number of 140 is not a thing anymore. So even, if I have people who work with heart rate monitors, I will a lot of times tell them to just tune out to it right now, because that's really not your focus. Your focus is, how do I feel? If you're getting to a point in exercise where you feel faint or dizzy, I'm going to tell you to dial back. But you know what? If you're not pregnant, I'm still going to tell you to dial back.
I was just about to say.
So again, a lot of the things that are true in normal exercise are also true in pregnancy. We just think about it, obviously, for such good reasons. We think about it more.
Right.
So that's not a specific number anymore. It is based on feeling, right? Go based on how you feel. Right. It's going to be a little bit different for everybody. So don't get too locked into a number there. No running. We kind of already touched on that. That's not a thing. You can absolutely run. Again, that's going to be based on you and your body, though, right? Have you been an avid runner? Do you like running? Do you enjoy that? Does it feel good in your body? again, I thought I was going to be a runner until I figured out, boy, this really doesn't feel good. So there's a whole host of reasons during pregnancy. Your body is shifting and doing all these things. And for me, I had what's called round ligament pain, which is basically just these ligaments that are connected kind of down in your groin, and they're connected to the top of your uterus, and they're holding it up. So the heavier your uterus gets, the more it pulls on those ligaments. And so when I, probably around 20 weeks in my first pregnancy, when I was running, it was just this sharp pain. And it wasn't unsafe. It was just uncomfortable, and it wasn't fun. And so then I switched to other forms of cardio after that, just lower impact things, because that is what felt good in my body. Again, I have a friend, and she was running until the day she popped. And we're not talking like she was running fast. Like, she was still running 10 miles per hour. Like, she was running fast, right? And it felt okay in her body. She was runner for years. She was, and she knew that it felt okay and it felt good. So, yeah, so absolutely can run. It's going to look different person to person. You don't have to run. No twisting or rotation. This is a myth I actually see a lot in the yoga world. So they used to talk about that one, or they do talk about it a lot in the yoga world, because they're concerned about, and this will tie into another one as well, but they're concerned about restricting blood flow to the baby. And again, makes sense. So I would say, like, don't, especially, and it really only comes into play when you're doing yoga, right? But if you're doing yoga and you're holding a twist, don't hold it for a couple minutes, right? But I also tell people this: when you're that pregnant, you cannot hold a twist that long. Like, I'm trying to explain to my yoga instructors sometimes, like, if, they haven't been pregnant before and they're telling me, like, oh, yes, my certification tells me that I shouldn't be, that my client should not be holding a twist. I'm like, yeah, you can't. You can't. Like, if we're
literally not possible,
and you want me to twist my elbow to the outside of my knee and I'm 36 weeks pregnant, I can't hold that. So it doesn't matter if you're telling me to do it or not. So again, intuitively, don't force anything. Don't hurt yourself. Right? But there's going to be a point where you're going to have to modify that. But twisting actually is super valuable and important in pregnancy. So that's why I have a little personal vendetta against that myth, because twisting and rotation creates mobility in your spine and ribs. And when we lose mobility in our spine and ribs, it really restricts the way that we breathe. When it restricts the way that we breathe, not only is it uncomfortable, but it can have a big impact on the function of our core and our pelvic floor. So telling women not to twist is not helpful. Physical therapists literally prescribe twisting exercises and movements to help women be able to breathe effectively and manage core and pelvic floor symptoms.
Wow,
so
that is
good twist.
That's actually crazy, because that's another one where it was like, I should go to jail if I make someone twist. That's like, it just is so scary to think of, like, as a trainer. So, and I'm sure many of the women listening here just have that same old rule in their head. Is there somewhere that you'd recommend? And again, it's okay if you don't right off the top of your head, because I didn't have it written down, but like for these twisting movements, for example, is there a good place for women to find these, or any that you'd suggest? Or is it more like go see a pelvic floor PT, or what would you,
I would say, honestly, any upper and middle spine mobility movements are going to be so good for you, right? Cool. So if you're scrolling through Instagram and you see a reel or, a post that has, 5 stretches that are going to unlock your upper back mobility, whatever it is, as long as they feel safe and comfortable to you, awesome. Cool. So I'll do like a lot of like laying down ones, and where like your legs are kind of one direction, your arms are the other direction, right? There's definitely ones where, like, if we were in person together, for sure, like, I could go through and show you. But it's not necessarily really specific to pregnancy or postpartum. Right. It's really just thinking about movement through your spine, movement through your upper back, and then our ribs are tied in with that as well. So that movement and that twisting and that mobility is what really helps us be able to operate at a better capacity.
Okay, that's awesome. Yeah, that's awesome. And again, like she said, how do you feel? It's the same thing if you're not pregnant. Don't do what doesn't feel good. If it's painful, stop and get help.
Yeah, let's reassess. Yep.
And we're okay to lie on our back if we're in our 3rd trimester?
Yes, that's where that one was going next. So yeah, so along the same lines as the no twisting and rotation, there's also an old one of no lying on your back. And I'm going to go the same concept. Don't lay there for like 10 minutes, right? So they recommend when you sleep that you should sleep on your side, specifically your left side. If you're laying down doing a chest press or something, it's okay to lay down for a minute or two while you're doing those reps. I actually talk to women more about how to get in and up, like off the ground, and how to get down onto it. And that honestly becomes harder. So if there's a reason that I'm going to modify, it's probably because of that, because of the difficulty that it takes to lay down on the ground correctly and get there. But again, the concern is with restricting blood flow. Again, obviously that is a very big, valid concern. But there are signs of restricted blood flow, going back to feeling like dizzy, faint, nauseous, all those things. If you feel any of those things at any point in any exercise, stop. Take a beat, So that is not, it's not, restricted to just thinking about laying on your back or twisting or any of these things, right? All the time. We're keeping, our brain turned on, and we're thinking about the things that we're doing. And obviously, again, it just is a little bit more important when you're caring not only for your own body, but for your baby's body. But I would tell anybody, you feel those signs and symptoms anytime, let's get out of this.
Yes, please.
Yes.
Amazing.
Thank you for bringing that one up. So those two kind of go hand in hand. One more crazy one. I haven't heard it that often, but again, just like some crazy person on Instagram was like, you should not squat this low because you could rupture the membrane and like break your. I'm like, if it was that easy to break my water. Like, do you know how many people would be deep squatting at 41 weeks if it was that easy to send yourself into labor?
We do it on purpose.
Yes. Again, don't be dumb. Like, don't squat lower than you can squat. Don't do something that's uncomfortable for you. However, again, PTs will definitely give you like some different variations of deep squats because it helps release your pelvic floor. Many women will birth in a deep squat, so it's like, it's comfortable. If it's comfortable and safe, you can do it. But yeah, that was like a wild one that I saw one time. She was like, don't do this because you're going to go into early labor. I'm like, girl.
Also, just like, I don't know where she was coming from, so maybe this is a little judgy, but shame on you, because that is terrifying to just spread misinformation that you're going to rip the membrane. That is terrifying. Obviously, I'm assuming if we're feeling heaviness or downward pressure, pull back, because we've talked about this with our pelvic floor physiotherapist too, but not because you're going to rip through your membrane, but just because, again, like we talk to anyone. But that is wild. I'm like scared for people when I hear that. Okay. Thank you for letting me throw those in. I do think those are really, really important. And I think a lot of people just from that segment alone are going to take a lot away, because it's so, like I said, there's just so much fear around it. And as a trainer, a lot of those were still things that I was, can I do? And it makes sense. Like you said, a lot of them, like the twisting and probably getting up and down off the floor, are fine to skip just because it's harder to do. You don't want to hold a twist. You don't want to get all the way down to the floor and have to get back up between a superset. So that makes ton of sense to me. So, all right.
Okay, all right. Can I throw one more in there?
Yes, please.
This is one. Not the big one, but a big one, right? So like I said, one of my big questions was, can you work your core, right? So that I feel like, and I think, is that a myth? Is it a question mark? I don't know. And I mentioned earlier, yes, but in specific ways, right? Or there might be specific things that we avoid. So, we have different parts of our core that function differently. They have different purposes. The biggest thing that we recommend during training your core when you're pregnant is to avoid a lot of pressure on the front of your core, or your abs, right? So when we think about our six-pack muscles, there's two sides of it, and it's connected by this line of fascia called your linea alba in the middle. And that is meant to, it's more pliable than your muscle. It's meant to stretch. It's even meant to separate a little bit. That is how our body allows room for a baby. And it honestly is how our body allows to just change throughout life. To, it adds that flexibility and that room for movement. So I always tell people you are going to experience some level of diastasis recti or DR, even if just a very small amount. So I always tell people to not be scared of that. But most of the core recommendations that we give during pregnancy and postpartum are how can we minimize it? How can we minimize it? How can we make it easier to heal postpartum so that we can return stronger and better functioning as well? So avoiding exercises that really directly impact and put pressure on those front abdominal muscles is what we want to try to do. And so that's a reason that I wouldn't coach people through sit-ups through,
Sure.
later on in pregnancy. That would be, if you can imagine if you're laying on your back and you're doing like supine leg lifts, right? You're lifting your legs up and down. This is one of puts so much pressure on those front abdominal muscles.
Right.
Again, it doesn't matter if you've had a baby or not. I almost never see somebody do those correctly.
Yep.
So that's an exercise for sure. Bicycle crunches, like anything where you're laying down with your legs extended like that puts a lot of pressure on them. Anything where you're in kind of like that sit-up motion can put a lot of pressure on them. And you're like, well, how do I know? Great question. I know you were going to ask that, Kinsey. I can just do the podcast myself. Let me just have a conversation.
You know what? I'm going to go out and get a coffee. You good?
So how do you know? You look for what's called coning or doming, which is basically just when you see kind of this like bulge through the center of your midline. And I tell people when you see it, don't freak out. It doesn't mean like, oh my gosh, I've done damage, right? It just is a sign that all the pressure in your core and your diaphragm is moving into that front area. We're putting too much pressure on it. So readjust, right? Whether it's bending the legs, alternating the legs, picking a different exercise, whatever it is, or just even taking a moment to rest, reset, and re-engage your core. We want, when we're doing those kind of traditional core exercises, your core should flatten. It shouldn't raise or bulge in the middle. So it's not something to, again, it's not something to freak out about. Like I'm not about fear or scare tactics.
Right.
But again, it's just a sign that our body's not handling the pressure the way that we want it to continue to strengthen our core the way that we want it to.
And that doming and coning,
Yeah.
that happens with non-pregnant bodies too.
Yes. In fact, I have worked with, middle-aged men who have experienced it and gone in because they thought they had a hernia and got scheduled for surgery. And then the doctor was like, wait a minute, this is just diastasis recti. So again, not a lot of knowledge in that specific area, but but it can be healed. It can absolutely be healed. Work with a good pelvic floor therapist or a good postpartum specialist, and through different like mobility, breath work, core pelvic floor work, all those things. Those can, it can be healed and it can be strengthened. So that's just why during pregnancy we try to do as little damage to it as possible, because we know a little bit of it's going to happen, but how can we set ourselves up for success on the other side?
I love that. And to tap back what you said before, which is it's not that we're harming the baby, it's that we're doing what's best for mom in this case.
Yes, right? Yes, exactly. Bicycle crunches are not going to hurt the baby, right? But if you see the coning and doming a lot, you're just putting a little excessive pressure on your core and your body, and it's going to make it harder for you to heal afterwards.
Okay. That's a really, really helpful thing to hear. Okay. Wow. Thank you so much. That was, my mind is blown, like I said, and I'm sure a lot of people took a lot away. Definitely go back and re-listen to that. So here we are at the end of the journey. We've gotten pregnant. We've gone through pregnancy. We've had our baby, and we're now postpartum. What is the very first thing I should do as soon as I give birth? Can't just lie there for weeks and enjoy life.
Sure. Again, this is going to be personal, right? It's going to depend on how your birth went. It's going to depend on whether it was vaginal or C-section. All the factors. It's going to depend on your comfort level, your support, whatever. But even as early as an hour post-birth, you could start gentle, intentional breathing. So, again, I talked about one of the biggest things that I learned when studying prenatal and postpartum fitness is the concept of what's called 360 breathing. And this is a concept that pelvic floor therapists work with. It's a concept that prenatal postpartum specialists work with. But essentially, we want to, your core, your diaphragm, and your pelvic floor are all connected. They make this, canister or can, if you will. And when one part of it is not functioning well, it really breaks up that connection and it disrupts things, right? So we want to just start to breathe in a way that everything starts to function and coordinate well together again. So 360 breathing is a tool that we use to start to find that re-engagement and connection. So it's very, very gentle movement, but it's intentional. You can literally just lay in bed, feet down, knees up, and focus on 360 breathing. If you YouTube a video of 360 breathing, I bet you could find a ton. I recommend one from like a pelvic floor therapist or a prenatal postpartum specialist. But it's a simple concept. It takes practice to do it, but it's a simple concept. So 360 breathing, you can start right away. And then from there, you can start to lace in gentle mobility, really gentle for the hips, but, like we talked about, through your spine and your upper back can get really stiff during pregnancy. If you are breastfeeding or even if you're bottle feeding, you're leaning forward a lot, and that can create a lot of tightness and tension. That, again, when we have that tightness and tension, it restricts our breathing and it keeps everything from functioning well together. So you can start, gentle mobility, and then, kind of progressing through the weeks. You start with body weight movements and, especially like starting with more like laying down movements, and you just kind of start to progress. Again, this is where it can be helpful to work with somebody who can give you a really specific plan to what you and your body has gone through and what it needs right now. But you do not have to wait until the 6-week mark to start any kind of activity or movement, and I really don't recommend it. So I do not recommend sitting on your couch for the next 6 weeks. Do you need to take that downtime and recovery? 1,000%. Should you avoid stairs for the first week or so for your health of your pelvic floor? If you can, absolutely. Should you ease back into even just things like walking? For sure. A lot of PTs recommend trying to lay on your side more when you're recovering and not just on your back, because it can put a lot of tension on your pelvic floor, on your posterior pelvic floor if you're strictly on your back. So you definitely need to recover. You definitely need to ease back into it. But this thought of like, I do nothing until my 6-week checkup and then I do everything, that's the problem.
I love that. No, I love that. And that 360 breath is another one of those tools that I just feel like any human should be doing, because so much of us don't have access to the pelvic floor. But I think I love what you said, because I do know there's so much, again, kind of fear around like, I don't want to prolapse. I can't do it. But a little goes a really long way with that breath, with that mobility. And it's interesting because I was just, everything that you've mentioned about both why we need to support glutes and hamstrings as we're getting pregnant, into the breastfeeding, the shapes of pregnancy. We're just holding our body in very different movement patterns, or we have a center of gravity during pregnancy that's very different. So just that reminder that like our body is doing a lot of things that it doesn't do outside of this time frame. So finding ways to support that. I love that. I feel like you did a really good job right now of just kind of giving us the answer to this, but is there like a normal timeline for returning to workouts in terms of like strength training, or is it person to person? Is there like a common, like what's the deal?
Yeah. Yes, person to person, right? Everybody's going to be a little bit different depending on what was your previous activity level look like, what's your comfort level, what was your birth experience like. So all those are going to play a really big role. And anybody that you're working with should have like a pretty detailed conversation with you about all those experiences, right? Like we get into the nitty gritty about like, what's your poop life like right now?
Heck yeah.
So all those things play a role and factor into it. But yeah, so like when to start, training or weight training again. Again, we want to start with those body weight and foundational movements and then progress lightly from there. I always start with, from body weight, then I progress to bands. We want to, again, be careful of loading our pelvic floor too much in the beginning. That's something that we really want to work back up to. So that's going to be one of the biggest things that you're going to hold back on jumping right back into those heavy weights, right? So where Becky got pregnant, found out she's pregnant, and went from a 50-pound goblet squat to a 10-pound goblet squat. And I was like, knock that off, Becky. But now I say, yes, Becky. Now
Yes, Becky.
I want you to build back up slowly. Do not jump right back to that 50-pound.
Get it, Becky.
Yes.
Which makes sense. I mean, essentially, where your body went through a big change, ladies.
Yes.
So it's building the foundations the same way you did when you first started. And that to me as a trainer, so for all my trainers out there listening, I think that is something that we should take away too. It makes a lot of sense that would be how we approach this phase, is we're starting to train the body back from essentially, I like to think of it as like ground floor, since that pelvic floor really is literally ground floor. So just starting with, I love that. The body weight, the bands, as always, listening to our own bodies. I love what you said early on about us being intuitive. Even if we're new to workouts, we have a pretty good idea. We might be a little overly cautious sometimes, especially if we have a history of injury, but it's not a bad thing. That's why it's nice to work with someone who can help kind of teach you like, okay, this is uncomfortable, and then this is like pain that we want to avoid. But definitely listen to your body. We know when something's up. So I love that. Gosh, you have given us such good information. I don't want to keep you too far past our time. I feel like I just need to have you back on another day. But if there's don't threaten me with a good time, you guys. Send me all your questions, because I feel like you just gave us a master class, but like we had to do the Cliff Notes edition. So please, everyone, I know you're going to have questions. You did such a good job of giving us things to think about. If you have follow-up questions, hit me up, Kinsey at fitafter40.info, and we can have Coach Anna back on to answer them, or you can just reach out to her directly too, or both. But before I let you go, what's one big takeaway you want our listeners to leave here with today?
Yeah, big takeaway for women who are considering getting pregnant, postpartum, all those things. You are not fragile in pregnancy, right? Your body is doing incredible things. And I think that we forget, because this is the only way life comes into the world. So it's obviously very common, but it is unbelievable what your body does to bring this baby into the world. And so you are anything but fragile. You are so resilient. You are so strong. And listening to yourself, using the right tools, can really help you out along the way. To all my trainers and instructors, get certified. I know you have to do those continuing ed credits anyways. Do your prenatal and postpartum ones, because not only is it going to benefit you in terms of when you're actually working with people who are pregnant or postpartum, but it spans to everybody. You're going to learn things that you're going to apply to everybody in all walks of life. And if you think that your one chapter from your textbook tells you everything you need to know about prenatal and postpartum training, you are wrong. And I can say that because I have been there, but it does not tell you everything you need to know. And so do it. You got to do that continuing ed anyways. I highly recommend it.
I love it. And I can say that because I've done a lot of continuing ed, but not that one. And I learned so much today.
I know it's hard to pick and choose because we love to learn, and there's so much. And I could say the same thing about, perimenopause and menopause. That's like next on my where I want to journey down,
We just need to trade.
Yes, could we just swap info, just swap brains for a
right?
day?
Like mind meld. It's 2026. There's got to be some way to do that.
Some way to do it, yes.
Okay, I love that. I love that you are strong, you are resilient, you're literally an Olympian. Your body's going through something. It's of Olympic proportions. So I love that takeaway. And I know people are going to be just like kicking through doors to get to you. How are some ways for them to find you, to find your studio? Just hit us. I'll put the links in the show notes to y'all, but I love for it to just them to hear it too.
Yeah, totally. So my husband and I own a local wellness studio called Carpe Diem Studio in the Twin Cities. So if you're local, I'd love to see you. It is not prenatal and postpartum specific, but obviously if you take class with me, we are definitely going to chat, and we can talk about all the things. I also specifically train my instructors to be more educated in this area than you are going to find at most other gyms and studios, because I'm so passionate about it, right? So even if they aren't fully trained and certified, they have more knowledge than most do.
I love that.
So we offer classes. We offer anything from yoga to fitness. We have massage therapy. We have red light therapy, cold plunge, infrared saunas, all those things.
It's a
So
really cool space, you guys. Sorry to cut you off.
no, it's good. You're good. Yeah, we love it. You can find me on the schedule. You can take class with me. Otherwise, you can find me on Instagram at Mrs. Hulty, MRSHULTY. Yeah.
Woohoo! And again, I will put all of that in the show notes. Definitely check her out. She does really great. How old is your baby girl?
Yeah, Freddie.
Freddie.
Yep. She is 6 months.
Okay. When Anna first had Freddie, she was doing some really cool. I loved the things you were putting on your Instagram about how you were getting back into it, which was going to be one of the things we talked on. And
do it all the time.
Yeah, I love it. I love it. So we didn't get to touch on it today, so we'll save it for the next pod. But her Instagram is a really good source of and it's not going to clickbait you with pregnancy safe. It just shows a woman who had a baby starting to move her body in a way that's supportive, and she's an expert. So namaste. Okay, thank you a million times. I said I wasn't going to keep you over, and here we are. So I'm going to let you go. I cannot thank you enough. Like I said, we've been excited for this episode for a million years, and I just couldn't have hoped for a better guest to speak on it. So thank you again for your time. And thank you to all of you for requesting this podcast. Honestly, this was the reason that I first started wanting to do interviews. So anything you guys want to ask, like I said, reach out to Anna on Instagram, or you can hit me up and we can bring it up on another podcast. Until then, please take care of your beautiful bodies and brains. If you got something out of this, share this. If you know someone who is thinking about getting pregnant, currently pregnant, postpartum, this is a wealth of knowledge. I say it all the time when we have beautiful experts like this, but when we're talking about the fitness and health revolution for women, it starts here, sharing actual information in a sea of noise. So share it. Someone else is definitely going to benefit from this. And as always, take care of your beautiful bodies and brains, because you're so stinking worth it. Until next time, y'all. Aroo!